me in.
Good morning, Miss Broom. My name is Madison. I'm a student nurse at Prairie Community College, and according to my order, it looks like we're going to be doing some vital signs and a physical assessment today. Is that all right?
Yes.
So a physical assessment is going to be a head-to-toe assessment, checking for any abnormalities on your body. Could you tell me your name and date of birth, please?
Christy Broom, 7/31/79.
Okay. And let me look at your armband. Any allergies I should know about?
No.
Okay. If I was in a hospital, I would make sure that the brakes were locked. I'd make sure that the side rail was down on the side that I'm working on so that it's easier to work on the patient. I would make sure that the bed is at a working height, like waist level, so that I'm not hurting my back. And I would make sure that the head of the bed is up far enough to where it's easier to work on the patient. I would make sure, or I'm making sure that the environment is safe. There's no clutter. I've got all of my equipment here that I need. Making sure that there's no indwelling lines, no IVs, no oxygen, nothing like that. Do you need to go to the bathroom before we get started?
Yes.
All right, I'm making sure that the door is closed. I am providing privacy to the patient. Do you know where you are today?
The hospital.
Okay, and do you know what the month is?
February.
And who's the president?
Biden.
Okay. As you can see, the patient is oriented, awake, alert. Her speech is fluent and articulate. She knows where she is. She knows what month it is. Her behavior is normal. She's cooperative. She's stable. Her affect is appropriate for the situation. So what I'm going to get you to do first is lift your arms up. Put it back down. One more time. Okay. Do your wrist like this. Okay. As you can see, she has full range of motion. All right. And how did you sleep last night?
Good.
How many hours do you get on average, do you think?
7, 8.
Awesome. All right. So first we're going to start with your vital signs, okay? And I'm going to do your temperature first. And this is a glass thermometer, so it's going to go under your tongue, and it's going to stay under there for about 3 minutes. Okay, and I'm going to let you put it under your tongue. All right, now I'm going to start on your pulse. Just lay it down like that. Okay, great. Your pulse was 90 and your respirations were 15. So within normal range. All right, I'll check this now. Okay. And your temperature is 97.4. So really good. I did shake the thermometer down before we started the video, so. Alright, now we're gonna do your blood pressure. Okay. Does it matter which arm I do it in? Have you had any like mastectomy, no fistulas or anything?
No.
Okay, great. Put your, this please. Okay, and do you know what your normal blood pressure is?
I don't.
So I'm going to do the two-step method. So I'm going to feel for her pulse. I'm going to blow the cuff up, and then whenever her pulse goes away, I'll blow it back up, or I'll deflate it and then I'll blow it back up again, 30 above that. I'm about to go away to about 100, so I'll blow it up to 130 this time. Okay. Stethoscope ready. Alright, I got 120 over 90. So, vital signs are all within normal limits. Okay, so I'm going to start with your head and your neck area first. And the first thing I'm going to need to do is I'm going to just feel your scalp, check for any lesions or any lumps or anything. That all feels fine. And as you can see, the patient does not have an NG tube. There's no oxygen, nothing of that sort. All right, next I'm going to check your pupils. So what I'm going to do is I'm going to shine bright light in your eye. I'm just going to need you to look straight ahead for me. Okay. One more time. Okay. Other side. One more time. Okay. All right. The pupils are 3 millimeters. They're round. They're reactive to light. And they can accommodate. All right. Next, I'm going to look in your ears. Just to the side like that. Okay. Looks good. Other side. Okay. And I'm going to look at your nose. Just lift your head, or put your head back a little bit. Everything looks great. I'm gonna look at your neck as well. Okay, other side. Okay. Now, oh, your mouth. All right, lift your tongue up. Okay, great. All right, now I'm going to just palpate your neck, just feel your neck for any jugular vein distension, any masses or anything like that. Okay. Okay. Everything feels great. Now I'm going to palpate the temporal and the carotid pulses. So I'm going to do the ones on your head, the temporal, and I'm going to do them bilaterally. Okay. Okay. Very strong. 2+, I would say. All right. I'm going to do the carotid. I'm going to do those one at a time. Okay. 2+ on that one. 2+ on that one as well. All right, next I'm going to listen to your carotid artery. And what I'm going to get you to do is just take a deep breath in and hold it for me. Okay? Other side. All right. All right, now we're going to do the upper extremities. Okay? So just lay your arms out like this. And I'm just going to feel the temperature of her skin and go all the way up the backs of my hands. It's very warm. Skin is dry. It's very soft and supple. Next, I'm going to get you to do your fingers like this and checking for clubbing. No clubbing. There's no IV sites on her arms or anything, nothing like that. Okay. Next, I'm going to palpate the pulses on her upper extremities. So I'm going to do all of these bilaterally. So first, we're going to do her radial on both arms. Okay, those are both 2s. Now we'll do both of the ulnars. Those are both 2s as well. And now I'm going to do her brachial pulses. Those are both 2s as well. Now we're going to check for capillary refill. So hold your hands out like this. And I'm also going to look at her nails while I'm doing this. Her nails look good. No abnormalities with the nails. Alright, checking for capillary refill. So I'm doing this to each of the fingers. And they are all less than 3 seconds. Alright, now what you're going to do is put your hands out like this. And I'm going to put mine right here. You're going to push against my hands. Okay? Leave them like that. And now I'm going to put my hands like this, and you're going to pull back towards your face. Okay, great. There was bilateral equal strength on both arms. Alright, so now we're going to move on to the chest area, and the patient's skin so far from the head and the arms has been, it's been pink, no discoloration of any kind. So we're going to move on, like I said, we're going to move into the chest area, and you're going to look at the skin and make sure that there are no cuts, bruises, wounds of any sort. This patient's skin is also pink. Her chest is within normal limits, no barrel chest. Nothing abnormal about her chest. Now I'm going to check her lateral ratio. So do that on her shoulder, and then go around to this side and measure it, and I'd say it was about half. So, which is normal. And next I'm going to get you to stand up. Okay. And then I'm going to check her spine alignment. All right. So you're going to bend down and touch your toes. So you're going to run your fingers across their spine and make sure that it's not no scoliosis, lordosis or kyphosis. All right, great. You can sit back now. And also her if you were to be like in a hospital and you were inspecting the breasts and the axilla, you would just be checking the skin and making sure there was no abnormalities or any sort of cuts or lesions. Right now, we're going to check the patient's respiratory system, her chest area. So her respiratory rate is normal. Her breathing is unlabored, even breathing. She's not having to use any of her accessory muscles to breathe. She's not struggling to breathe, no shortness of breath, anything like that. All right. I'm just gonna palpate. Palpate your skin and just check for make sure there's no tenderness or anything. I don't feel anything, no bruises, no lesions or anything like that, okay? And you let me know if anything hurts. Does that feel fine?
Yes.
Alright, now I'm going to check for skin turgor. So I'm going to pinch your skin. Okay, and it went right back. There was no delay on that. Now I'm going to auscultate the lung sounds. Alright, so what I'm going to need you to do is, I'm going to tell you to take a deep breath in, and you can just let it out. And then I'll tell you every time that I need you to take a breath, okay? Okay. Deep breath in. Out. In. Out. Okay. In. Out. Okay. In. Out. In. Out. In. Out. In. Okay. In. Okay. I'm gonna get on next to your armpit over here. In. Okay. In. Okay. In. All right, one more. All right. Now I'm going to check the lung fields on the back. So I'm going to get you to turn on your side, and I'm going to check you on your back. All right. Breathe in. In. Breathe in. Breathe in. Breathe in. Okay. Breathe in. Okay. Breathe in. Breathe in. Breathe in. Okay. And one more time. Great. No abnormalities in the breathing. Everything sounded fine. Unlabored. Everything was even. Okay. Now we're going to inspect the patient's heart. So there's 5 anatomical landmarks on the chest. So you'll have the aortic right here. You move over to the other side at the same point, which is the pulmonic. You'll move down just a little bit, and then you have the herbs point. Move down a little bit more, the tricuspid, and then 5th intercostal space, midclavicular line is going to be the apical. So now I'm just going to palpate all of those to make sure that there's no visible pulsations, and I'm palpating to make sure that I'm not seeing any or feeling any like lifts or heaves or thrills. Okay. Now I'm going to auscultate all those same areas. I'm going to auscultate them with my the diaphragm of my stethoscope and the bell of my stethoscope. I'm going to start off with the diaphragm. You can just breathe regular for this, just relax, it's okay. Okay, now I'm going to listen with my bell. And now I'm going to count the apical for a minute. Okay. I got 85 on that. So, within normal range. Okay, now we're moving on to the patient's abdomen. So, if you were in a hospital or a professional setting, you would be, they would have their gown off or they would have their shirt up. But first you're going to inspect. So you're just going to look at the abdomen, check for any, like, if there's a feeding tube, or if there's any wounds or any sort of drainage or anything, any cuts, bruises, lesions. Then you're gonna you would check the size of the abdomen. So hers is it's flat, it's symmetrical, it's not bloated. There's no hernias or anything. Everything is normal. You would also look at their umbilicus, and you would check to see if it was concave or if it was in or out. So you would check that, and then you would check to see if it was also symmetrical in the abdomen. All right. So what I'm going to do now is I'm just going to press down on your stomach. And I'm going to start out light, and then I'll get a little deeper. And you just let me know if there's any tenderness or anything, okay? And I'm just checking to make sure that her abdomen is soft and it's not firm. Does this hurt at all? Any tenderness?
No.
All right, now I'm going to get a little bit deeper. Okay, and everything feels fine. All right, next we are going to auscultate the vowel sounds. So I'm going to do it in each of the 4 quadrants. All right, so I'm going to listen to your vowel sounds now, and you can just relax. All right, everything sounds good. Peristalsis seems to be working perfectly fine. Have you had any trouble with urinating?
No.
Any blood in there, or does it burn or anything?
No.
Okay. And when was your last bowel movement?
Yesterday.
Okay. And do you have any problems with that normally? Okay. And also, if this was a hospital setting, you would also, at this time, we'd be checking the perineal area of the buttocks for any rash, redness of the skin, any abnormalities of any sort, any skin breakdown or anything like that. All right. Lastly, we're going to be inspecting the legs and the feet. So, I'm going to be looking at your legs and your feet. I'm just going to pull this blanket up.
Okay.
Make sure to keep your private area covered. So you're going to inspect the skin. The skin seems to be pink. There's no discoloration. There's no edema. I can tell there's no swelling of any kind. There's no abnormalities, no lesions, cuts, bruises, no drainage of any kind. I'm going to look in between your toes.
Okay.
Make sure there's no rash or anything in between your toes. Nothing abnormal. Okay, I do see you have a cut right here on your big toe. Is that? Did you know that was
I
there?
scratched it at home.
So it's been there for a while.
Yeah, a few days. Yeah.
Okay, looks like it's healing up. It's healing up pretty nicely. So I'm also going to check your capillary refill on your toes, like I did on your fingers,
Okay.
and so far same thing with the fingernails. They're coming right back. Less than 3 seconds on the capillary refill. Now I'm going to feel the temperature of her legs. So I'm just going to use the back of my hands, and I'm going to go all the way up her legs. They seem to be warm. The skin's dry, no sweating, it's not moist. It's very smooth, supple, and now I'm going to check the equal strength on her feet. So what I'm going to do is you're just going to keep your feet like this, and I'm going to put my hands right here and push against my hands. Okay? And I'm going to put my hands like this and pull against. Awesome. They're bilaterally equal strength. I'd give them, I'd say probably both, they're 4+. Next, I'm going to palpate your pulses on your feet and on your legs. If you were doing this in a hospital setting, you would also want to palpate the femoral pulses. So I'm going to start off with the dorsalis pedis on the top, and I'm going to do this bilaterally. And they're both 2+. Now I'm going to do the posterior tibial on the sides, and I'm going to do them bilaterally as well. 2+ on those as well. And I'm going to do the her popliteal pulses on the back of her knees, and 2+ on those as well. All right. Could you bend your knees for me? Okay, bend back down. Wiggle your toes. All right. As you can see, range of motion. She has no trouble with that. As far as I think we're done. I think I've covered everything. Everything looked great. There was no problems that I saw. So I'm gonna put your call light right here, and If you need anything, just press that call light. Somebody will come in here. The doctor should be in any minute and check you out. All right.
okay, thank you.
You're welcome.